Specifically at Banyan Boca, we do a really great job at treating patients who have an extensive history of trauma. We have clinicians specialized in ART, which is accelerated resolution therapy, anxiety, depression, and we also specialize in treating individuals with any sort of psychotic feature or a more intense mental health diagnosis like schizophrenia, schizoaffective disorder. We have a really gentle way of treating individuals with those diagnoses.
The clients wake up, the techs take their vitals. They are directed to have breakfast as well as their meds. They have groups throughout the day, breaks in between where they're able to read, journal. We have a patio area where they're able to relax. We have yoga throughout the day. We also have a chiropractor and a serenity bed. They are welcomed to go on outings, and after dinner they have a wrap-up group towards the end of the day where they kind of do a check-in with each other, and that is a peer-led group where the clients are responsible for checking in and make sure that their peers are doing well.
We have nurses on site 24 hours a day to tend to all of our patients' medical needs. So if a patient comes in and they're experiencing some sort of mental health crisis or withdrawal from drugs or alcohol, they're able to attend to that immediately. In addition, they're here to help anybody who has any medical conditions that might be co-occurring in addition to their mental health. So if they come in with asthma or they come in with diabetes, we're able to manage that while they're here throughout their stay.
So the clients are provided a team with not only their therapists, but with case managers. The case managers meet with them while they're here, address any concerns that they have, but one of their main focuses is their aftercare planning. We always encourage lower levels of care for integration, and we look to see what facilities suit them best if they are more mental health or substance focused, and we ensure that they get where they need to go and that they have everything that they need once they transfer.
So Banyan Boca focuses on cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, several different trauma modalities, and psychoeducation. These are done in either a group setting or an individual therapeutic setting.
We are primary mental health here. So if you have a history of mental health, whether it be diagnosed or not, that is something that you can kind of hone in and focalize while you're here. We do address substance here if that is something where you have a co-occurring, and we're able to, provide that attention that mental health has been neglected for a long time.
I think Banyan as a company comes from a place of compassion. Most of the people that work here, people that run the company, people at our corporate level started out at Banyan as therapists or BHTs or on the floor, so they understand the struggles that not only our patients are going through, but our staff is experiencing as well. And so we have a unique perspective in the way that we handle things, not only from the patient perspective, but from the employee's perspective. The patient's care team is comprised of a provider or a psychiatrist, a therapist, a case manager, nurses, and BHTs.
So we focus a lot on a holistic approach to therapy. We utilize yoga, we have a yoga instructor 6 days a week, sound healing, chiropractic care, art therapy, equine therapy, as well as, when clients identify that they have other needs that may need to be met in a therapeutic way, the therapists are trying to work with them on that as well. So if they're, a hands-on learner, a visual learner, an auditory learner, we try to incorporate that into their treatment plan.
We have an admissions line that you're able to call. It is open 24/7, and you are able to ask questions regarding what our facility looks like, what to expect, how often you can see a provider, what type of support that you'll receive. They also provide a lot of information that you might not have thought to have asked. So starting that conversation with our admissions team will help get you to where you need to go in regards to which facility is most appropriate for you as well. Absolutely love the team that I work with here. I have been with Banyan, this facility specifically, for about 6 years now, and I have watched the community itself change from substance to mental health, and our team has been able to adapt, overcome, and work together and find the best ways that we can serve the clients, and we're always motivated to assist each other, and I think that's very important for mental health in itself.
If you have a gut feeling or a concern about something that you're experiencing, or even a loved one is experiencing, make the phone call because it could save your life or someone else's. If you or a loved one is struggling, call Banyan today.